Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the July 13th media availability. Thank you for being here. With 26 new cases confirmed just this month, how close is Humboldt County today to the threshold for being on the state's watch list?
Well, people may be aware that there are a few factors that go into the monitoring list: the number of cases per 100,000 population, the positivity rate of our cases, as well as the state in terms of hospital and ICU beds. So our hospital capacity has been perfectly adequate. We're okay on that sector. We've certainly seen an increase in both our case rate and our positivity rate that is of concern to us locally, but still falls below the state guidelines. In order for us to be on the monitoring list, we need to not only have 25 cases per 100,000 in that time period, but we also need to have a positivity rate that is greater than 8%. So we have not met those yet, but we're monitoring that daily, and certainly we've been concerned about some of the recent trends.
With more and more places opening up and people going back to work, can you talk a little bit about what employers are required to do when a case is reported at their workplace? Are they required to notify all employees or just those in direct contact? And does the entire place need to be shut down for cleaning, etc.?
So for every case, it can be a bit different. Typically what happens is when a case is identified in an employee, then public health, as part of the contact investigation, is speaking with the employer and that setting, as well as the employee, to identify close contacts within that work setting, and then during the infectious period. And then the investigation goes forward from there. So in general, businesses are supposed to be doing enhanced routine cleaning, and certainly it's, when they do in fact have a case on site, often it's enhanced even further in that setting. But whether a business needs to actually close to do that really depends on the business itself. In terms of the employer working with other employees and notifying them, again, typically that is led by public health based on what we are seeing as workplace exposure.
With local COVID-19 cases going up, why is the call center run by the thejit reducing its hours? What message is the county sending to the community about how big of an issue COVID-19 is when it cuts back on access to having questions answered?
Well, I think as in most things here, we're both trying to be proactive and address issues, as well as being, using our resources wisely. So the thejit, in looking at the hours when they were receiving the vast majority of calls, felt that reducing the hours to those specific time periods made sense. And then, of course, if the situation on the ground changes, those hours can be expanded again. And that's really how the EOC is structured, to contract and expand as needed.
Over the past months, the media has followed the unfold of the coronavirus. It seems as though news updates have become redundant. How has Humboldt County pushed to receive advanced and diverse data pertaining to effects of the virus in all minorities?
So, basically we're trying to respond to the questions that come before us. And, we certainly recently have begun on our dashboard putting race and ethnicity data forward so that individuals are able to see that, and also commenting, for instance, on the disproportionate burden we're seeing in our Latino community and why we have concerns about that. I think in terms of follow-up, we and public health are able to look at, for instance, hospitalizations in particular groups. However, long-term data on follow-up is really in the hands of care providers as opposed to public health. Certainly, we are monitoring the national and state data about what we're seeing in long-term health outcomes for minority populations as well as all populations going forward, and are certainly concerned, again, about the trends that we're seeing in communities of color.
I think you've answered this, but do you research these demographics?
Yes.
In order to address the disparity in COVID cases among our Latino and Hispanic community, for the purpose of making health and safety information readily available to those folks, has the thejit or DHHS made use of any Spanish-speaking staff members for the purpose of formatting information or hired a translator to produce information in Spanish? Have you considered providing these media Q&A videos translated for that community? Do you have any suggestions on how media can help get information to that community?
So, being able to communicate this information in more than one language is definitely a goal and has been a priority in the JIC. And many of our materials have actually been produced in Spanish language, and there's an FAQ on our site that actually is available in Spanish as well. In addition, the JIC always has a Spanish-speaking member available for phone calls during its open hours. In public health, we actually are using Spanish speakers for some of our interviewing as well, and we find that that's really helpful to sort of make the process easier for the people that we're speaking with and getting more timely information. In terms of videos, I believe we've worked on having our COVID minutes available in Spanish, many of them as well, and targeting that. But I think reaching out to these communities that are not English speaking is an ongoing challenge, and we welcome assistance from the media in helping to get that information further and further afield. And certainly we have had contact with some organizations serving these communities to try and work on how we could message better. So we actually look forward to really engaging there and seeing what we can do to improve things.
And there's also a feature that I recently learned about, that when you right-click on a page, you can actually select for them to translate it, and it will bring you to Google Translate, and you can translate it into another language.
Yeah.
So that is also accessible on our website.
That's great.
Has the JIC/DHHS been successful in adding local staff to the optimserv COVID-19 testing site at Redwood Acres? And for how much longer do you foresee that resource being available to Humboldt County residents?
So the optimserv right now is contracted by the state through August 31st. We don't know what the plan is on the state's end at that point, and but we're certainly not relying on the fact that the state will continue that. Because of challenges we've been seeing with turnaround times with the Optum site, and because of the possibility of the state not being on board after August 31st, we are actively exploring other options, both to try and ensure that we have an ongoing sustainable unit here, as well as something that may secure us some really optimal turnaround times, considering the incredible demands being put on the system for that. The EOC does not staff the collection site. That is staffed by Optum itself. However, our EOC has been putting in a lot of time supporting that staff and the effort in that testing site.
Thank you. At a free testing site in southern Humboldt, the turnaround time for COVID-19 test results are 8 to 10 days. One community member has reportedly had a complete 14-day quarantine period before getting their test results back. I guess there's not really a question there.
An observation, right? I completely understand that. And we're certainly hearing from Optum 8 to 10 days. We're seeing that not uncommonly. It's, as we've talked about before, is a huge concern. It is of very little utility for us in terms of certainly using it for our contact investigations if we cannot get a turnaround time that's quicker than that. And again, another reason for us to explore other options. I think it's important for people to understand that this is not our local challenge per se. This is a national challenge. The shortage in supplies for testing reagents, for testing supplies in terms of specimen collection has just, in light of the massive increase in testing being conducted throughout the country, has just overwhelmed capacity. So while we were sitting pretty about a month ago in terms of really being able to get what we needed out of the system even, it's becoming increasingly challenging, and everyone who's trying to accomplish this work is really struggling to do so.
Should asymptomatic people still get tested?
We are still asking people to do that at Optum. They certainly are able to. From a capacity standpoint, at some point, obviously, it will become increasingly important to use a site such as this to test symptomatic people and people exposed. For us to be able to do that in a meaningful way, we need a better turnaround time, frankly. And so what we're trying to do right now is to really focus on getting symptomatic people tested and sent to our lab internally at the county, because we can get a quicker turnaround time. We don't have infinite capacity, so it's not a long-term solution, but right now we're trying to do that.
Can you share an estimate of how many positive cases of COVID-19 have been confirmed, residents or non-residents, that are linked to the cannabis community?
Well, all I can say is we've certainly had a substantial number of cases in cannabis-related industry, and even more importantly, a lot of secondary cases in context of those individuals. And, it's not particularly surprising. We know that in places where people, are working, whether it's agriculture, packing industries, other things, there are certain risks there. And so it's been a real focus for us in terms of trying to outreach to that community to assure people that, again, from a public health standpoint, we're really not concerned about the specific, legality of the grow itself. If that's the issue, it's really a concern about making sure we're getting workers tested and, sort of managed appropriately when people are ill, as well as trying to ensure that all the best prevention measures are in place, just as we like to do for all sectors.
Thank you. The next few questions have to do with the weddings that were reported to be taking place this past weekend.
Mm-hmm.
Any enforcement questions we will forward to the sheriff, and he will answer those for reporters.
Okay.
I'm still going to ask the full question, but you can
Okay.
just, answer from public health.
Okay.
You mentioned last week that the Public Health and Joint Information Center fielded calls about planned gatherings. Are you able to confirm whether or not a wedding with hundreds of people took place this weekend in Petrolia? And if it did, what are some of Public Health's biggest concerns moving forward? Do you think we'll see a spike in cases because of it?
Well, again, I think these gatherings are of huge concern to us. Certainly what we are seeing in our recent cases is gatherings being an underpinning of much of the extended cases, as well as the initial contact that caused transmission. And so, to me, honestly, the idea of gathering, 100, right now, gatherings of 20 people are not allowed. Gatherings of hundreds of people are clearly, vastly outside the state and local orders and are frankly illegal. And so, I sympathize with the desire to have this bit of normal, but we really just simply cannot function this way right now during this pandemic. What I can tell you is what we're seeing across the state in terms of the increasing cases. I was on a call recently about this. It is not just us seeing this regarding gatherings. This is being seen across the state and is driving a lot of the numbers that are resulting in increased hospitalizations and ICU admissions. So, our focus is continuing to try and provide that information to people, encourage them to do what is safest for both their guests and the residents of the community, and not hold gatherings of this size. People need to improvise and do something a bit differently.
Is there a safe size of gathering that people can hold?
Right now, I know this is frustrating to people, but right now there is no allowance for gatherings of people outside your household unit. All I can tell people is that if they are pulling together a small number of people that are not their household unit, the safest way to do that is outdoors. Doing that indoors is really very unsafe. Outdoors, socially distance is better, but right now, not gathering outside the whole household unit is the safest thing we can do.
Thank you. This is essentially the same question you just answered. Also last week, you had expressed concern about several large weddings that were scheduled to be held over the weekend. Did those weddings go forward, and was the county able to have any impact on their safety procedures? How can people hold a wedding in Humboldt County these days under the current local and state restrictions?
Yeah, and I get it. Weddings, as we traditionally think of them, are not an easy thing to do right now. And so again, it really needs to be, ideally just a small number of individuals. Again, ideally household unit. I know that's not what people have in mind. And then deferring larger celebrations to a time when we can do it. I mean, it will come. It's just not now.
Why is the right to protest in a large gathering allowed, but not large gatherings for weddings and funerals?
Well, I suspect the rationale there is that, some things are considered constitutionally protected, and weddings and funerals I do not think have that status. Obviously, we have, for funerals, have made exceptions for people to be able to gather in groups up to 12, I believe, but really trying still to do distancing and really trying to limit exposures of multiple households.
What enforcement actions do police have at their disposal if the weddings mentioned last week proceed after being warned?
So again, I'll defer that to the sheriff.
Last week, Sheriff Hansel voiced concern about inmates being released to Humboldt County from state prison without any quarantine procedures. Can you explain how public health is working with the county's probation department to line up temporary housing for these people, and what's being done to ensure they don't pose an infection risk to the larger community?
So from a public health standpoint, it's hard because the system for doing this on the prison end is being worked out as it's having to unfold. And so I've appreciated that they've invited a lot of feedback from public health about how this can be done most safely, and in fact have established a work group to do that. Right now, we are generally being notified if there is someone who has either tested positive or somebody who has potential exposure or is coming from a facility where they've had outbreaks. And so that we can make sort of appropriate decisions about who requires isolation and quarantine, and then working on providing that local housing jointly with probation in our county so that people are able to be safe and away, for instance, from exposing family members, that type of thing, or other members of the public, and then releasing from isolation or quarantine as appropriate.
Excellent. Thank you very much.
Thank you.